You're listening to the Confident Choice podcast with me, Dr. Roberto Garcia, a double board certified facial plastic and reconstructive surgeon. Honest conversations and expert advice about the decisions that make you feel your best. Welcome everybody to episode 2 of the Confident Choice. I'm your host, Dr. Roberto Garcia from Contoura Facial Plastic Surgery in sunny and warm today, Ponte Vedra Beach, Florida. Our first episode launched, and we're really excited that we've had a lot of positive feedback about it. And one of the things that I wanted to kind of follow up our first episode with was this kind of mystique of what is happening during a consult, and what one can expect during a consultation. And so I can't tell you how many tens of thousands of consultations I've done in my career, and I've been at this for going on 21 years this year. 21 years, it's a long time. And it used to be that a patient really was going into a consultation with very limited information about the doctor, about the practice, and about the whole process. And so with the internet and with social media and with all of the disposable tools that the potential patient now has at their fingertips, the patient's a lot more informed when they come in for a consultation. And I've narrowed the consultation process, or rather, I focus my consultations now to the first major decision that we have to make is, do you need surgery or do you not need surgery? And if I'm able to solve a concern that a patient might have with a non-surgical option, then I'm probably going to try that first, right? I can't say that I'm a very surgery happy doctor that wants to, immediately jump into the operating room, because I don't feel that that's always the appropriate way to ameliorate the concerns that the patient might have. And so the second question that we have to come to in a consultation is this surgeon, because up to this point, you have probably seen their before and afters, you've probably been on their website, you've probably seen most of their reviews, so you got a pretty good idea about the practice, you have a pretty good idea about the surgeon, and you kind of want to find out, well, is everything that I've seen online matching with what I'm seeing in person? And I feel that during that consultation process, you're really trying to find out, you as the patient, and I'm going to get to what I'm looking for as the physician, you're really trying to find out if the physician sees what is bothering me, and can they correct what I see, and are they going to be there afterwards when things maybe don't go exactly as planned? Because by the way, that happens. It's not always, surgeons may tell you, yeah, I've done this 10,000 times, I've never had a problem. That's not true. That absolutely is not true. Any surgeon that tells you that they haven't had any kind of complication or any kind of ill result is lying to you. The surgeon that is honest with you will tell you, hey, listen, I have seen this before, and this is how I've corrected it. And the answer that one should be looking for in a consultation is, if a problem were to surface, do I have confidence that my surgeon's going to be there to help me in the after? Because a lot of surgeons do the surgery, they don't see their patients afterwards, And oftentimes when the patient comes back, it's too late. And so we try to absolutely lead you in an opposite direction to that thinking. After surgery, I bring my patients in very tight to me, because that's exactly the moment that the patient needs the physician and the aftercare the most, you know? And I'm often told people that I've trained, other surgeons that I've trained, the surgery is not the hard part is the aftercare. Because that's when the patient has no idea why they're seeing things. You're the only one that can really guide them. The patient is scared. They're concerned that things aren't going to look natural. We're going to get to that in just a minute. And it is your job to hold their hand along the way. From a physician's perspective, my job is to ask the question inside, is it reasonable what this patient is asking for? And if it is reasonable, that's question number one. The second question is, can I help them? Can I realistically say to myself, I see their concern, I can correct it. And a mistake that a lot of physicians make is they think they can correct something, and in the end, they don't correct it, and they end up giving patients a negative feeling about the entire process, and it ruins it for everybody. So that's where my consultations, that's the basic premise behind what I'm searching for in a consultation with our patients. The second thing is, how am I going to convey to this surgeon what my concerns are, and that I don't look like I ever had plastic surgery, right? It's kind of like that Navy SEAL mission, right? You go in, you get out, you complete a mission, but nobody knows you were there. That's really what the art of what we do is, right? I don't ever want somebody to say to you, wow, that's a nice facelift you had. Who did it? And the reason being, if it's done correctly, one would never suspect that you had that done. One would only think that, wow, you look fantastic. I can't figure it out. Something's different. Have you lost weight? Have you changed your hairstyle? Do you have new, different makeup on? But the last thing that they will think is that you had something done. And that's the natural look. Now, in future episodes, I'm going to get into anatomically how we achieve that natural look, so that our patients never give off that, oh my gosh, they had something done, right? And so I think that the naturalness of the procedure is one major component. The second thing is, what does my recovery look like? And as surgeons, I think we need to be honest with our patients and say, all right, listen, you're not going to heal in a week. It's physically impossible. The reason is, if you were able to heal in a week, we probably didn't do too much that's going to last. Because it's almost impossible to ask a surgeon to have you healed and recovered in 1 week for a process that has taken 20 years to occur, right? I can't undo 20 years of anything in 1 week. It's impossible. Now, it's not the 5 months of recovery that you heard your grandma talking about when she had a facelift back in the 80s. But generally speaking, I almost overshoot my recoveries with my patients, and I want you to expect, all right, depending upon the complexity of this, it could range anywhere from 2 weeks to a month and a half. And that's how you have to kind of get in your head that, hey, the recovery might be extended depending upon what I'm having done. Now, there's a caveat to that, because what patients oftentimes confuse recovery, I say passive recovery with active recovery, are two different things. Active recovery is those first couple weeks where you are going to have bruises, you're going to be swollen, and you're probably not going to be in front of a lot of people, just because you might have some level not only physical discomfort, but societal and emotional discomfort. The second part of recovery is passive recovery. And there you're able to function entirely normal. Most of my patients are back to work in anywhere from 10 to 14 days. And so that's that passive recovery moment, right? And that's that transition from active to passive is at around that 2-week mark. And so our patients are able to get back to work. They may have some bruising, which they can cover up with makeup. And they may have some swelling, but again, in most cases, the swelling by 2 weeks is usually down to about 20% left. And in most cases, you having 20% of your swelling still there is better than where you started from before the surgery, you know? And so I think that recovery is a major component, a major thing to ask about in your consultation. Discomfort, pain. Almost every patient wants to know how is pain managed. And I have my own special, what I think is special. Every surgeon has special techniques, by the way. But I have ways that I mitigate discomfort. And for the most part, the facial procedures are not uncomfortable. Now, every once in a while I get outliers, and I have patients that do complain of discomfort, and that's just, everybody heals a little bit different. But those are the major concerns that I see patients questioning about is recovery, the naturalness, and discomfort. And obviously we discuss what are the complications, what things can happen. I give you percentages as to what are the odds of complications happening. The actual consultation process is about an hour long, and many times you'll meet with my my patient coordinator, and she'll address a lot of these concerns and take photographs of you, and we'll begin to kind of show you, okay, realistically, these are the things that can be corrected. And just today I was talking with a patient who came in with 5 or 6 different concerns, and I said, hold on a second. Let's get to what is your main concern. Well, my main concern is my neck. Okay. So why don't we correct that first? Because if that's the issue that drew you all the way in here, and I think we talked a little bit about this last week, but if that's what took you all the way down this path, then we correct the one thing that's really, really bothering you. And I would say 9 times out of 10, after you've corrected that, you completely forget about the other stuff. And that just tells you, kind of echoing on what we were talking about last week, the importance of self-deprecation, right? We want to avoid self-deprecation. We want you to fall in love again with your face. Falling in love with your face allows you to be better to other people, be better to yourself, better to other people. And so the consult, as I kind of see it and as it's kind of evolved over the course of years, I would probably say it's more of a conversation than it is an interview. You know, it used to be during my what I saw early on when I was training, the surgeon would sit on one side of the desk and the patient would sit on the other, and it was almost like a job interview. You know, are you good enough for me to do your surgery? And the patient's thinking, are you good enough for me to let you do my surgery? And there was this back and forth ego thing between the patient and the physician. And I always thought that was super uncomfortable. So what I ended up doing is I kind of shifted the whole gestalt of the consultation to more of a conversation, an educational moment for both of us, where I'm learning about you, I'm learning what your intentions are, what your expectations are, and you're learning about me. And you're learning, is this the type of surgeon that's gonna be able to complete the tasks that I'm looking for and be there in the aftercare. So the idea of it being a conversation versus an interview, I think makes it a lot more of a comfortable experience, and patients do tend to do a lot better with regards to their anxiety, because think about it, this is not an easy thing to do. It's not an easy task to admit that there's something wrong or you don't like about your face, get in a car, drive halfway across town, and confront somebody who's about to pick you apart. That's a very humbling thing. That's very hard for somebody to do. And so that's why it has to be a comfortable experience. And so one final note before I get into my favorite section of our podcast is the importance of haste versus being pensive about the decision. And we will always promote patience in this type of decision, and we never want our patients to make any kind of hasty decisions, only because the importance of this, but secondly, it's something that really needs to be digested, and it's something that needs to be pondered upon and spoken to with friends and family. And oftentimes I'll have patients come back for a second consultation, only because there was so much discussed at the first one that questions and concerns started coming in afterwards. And so we do what I think is a fairly good job of really addressing your concerns the first time we meet, but oftentimes we do need to see you a second time. So my last section of this episode of the podcast, which is my favorite part, because it's a part about my dad. You guys are probably going to start getting bored with this, but I think it's fun. Every week I talk about a lesson that I learned, and the one that came to mind this week was the idea that my dad taught me when I was a young kid. The people you surround yourself with are more than likely the people you will become, right? And the 5 people you are closest to is who you're going to be. And you've heard that before, right? And so I always kind of made a point of being around good people, individuals that I wanted to aspire to be. And I think if there's a lesson that many lessons I've taught my kids, but with regards to this, is surround yourself with people that are better than you at things, right? Don't be the all-star in the group, because when you're the all-star in the group, you're no longer growing, right? And so I always kind of, even when I was in school, I would be in study groups with people that were smarter than me, that were better students with me, and same thing in medical school and in residency. And I always wanted to be around attendings that I really looked up to, because I had a place to grow to. And so if I were to pass on this tidbit of information to the younger generation, is friend upwards, associate upwards, don't associate sideways, and definitely never associate down, because the lowest common denominator in the friend group will be where everybody ends up being, right? And so if you're the outcast and you're the superstar in the group, more than likely you'll friend down. So that's my lesson for today. Stay tuned. Episode 3 is going to be next week. We're going to be talking about some of the common fears of facial plastic surgery, and some of them we kind of touched on today, but we'll get into a lot more of them next week. So as always, good decisions come with confidence and patience, and we look forward to seeing you all soon. Thanks again.